Hi, my name is Elizabeth Hendy, and this is my breast cancer presentation. So for the background for breast cancer is the most occurring cancer within women worldwide. Breast cancer occurs in different locations in the breast, such as the duct, the lobules, and the tissue in between both. Normal breast development and mammary stem cells are regulated from a few different signaling pathways, such as estrogen receptors and HER2. And these two pathways control stem proliferation, cell death, cell differentiation, and also cell motility. So the disease process. Scientists believe that breast cancer occurs when breast tissue grows at an abnormal rate. So the cells begin to divide rapidly, and this overgrows the healthy normal cells, which then accumulate and pile on top of each other, and that is what you feel in your breast when you feel a lump when you get mammograms. You can also inherit breast cancer, so you have a more likely chance to get breast cancer if it's in your immediate family, like your mother, your sister, or your daughter. Radiation exposure, gaining your period at a younger age, younger than 12 years old, and also the gene mutation BRCA1 and BRCA2 also increase your chances at getting breast cancer as well. So a few treatment methods include chemotherapy, which is where they give you chemo into your body, and a mastectomy, where you just remove the removal of your breast. These treatments have been shown to show that they greatly improve the chance of survival. Yet despite this, there are psychological damages, and also there's always a risk that the tumor can come back. So a normal signal pathway, this is what it looks like. And estrogen binds to the estrogen receptor. Estrogen receptors include two different types, ERA and ERB, which are two both highly homologous. Also, ER that occur in the plasma membranes are activated into the P1-3K signaling pathway. Estrogen binds to the ER onto the cell membrane as well. For the abnormal signaling pathway, which is what breast cancer occurs from. So there are two different binding sites. So estrogen receptors consist of G protein coupled receptors and nuclear estrogen receptors, which both activate and repress genes targeted during the ligand binding. So the pathway begins when ERA and ERB in the cytoplasm that then go into a ligand binding with the estrogen receptors, and then they produce heterodimers. ERA heterodimer and ERB heterodimer are all within the cytoplasm. So these three then go down to the nucleus and bind with DNA to produce ERE, which is estrogen response elements, and non-ERE. Within the second bonding site, ligands prepare to bind with the HER2, which is occurring in the cell membrane, and then go down into the phosphoryliphates within the tyrosine kinase domain within the cytoplasm, which then initiates downstream pathways such as the RAS MAPK pathway. During this, the GAB2 scaffold proteins act as a downstream tyrosine kinase to transmit and amplify signals going down to the downstream effectors. And this is a picture of the abnormal signal pathway. Here you can see it has the ligands at the top, and here are the receptors, the HR2, and you can see it goes down to the MAP pathway, and this is where cell life progression, survival, and proliferation occurs, and then the tumor at the bottom. And these are my references.